on WBC. So in previous class we discussed MCQ on red blood cell. Now we see MCQs involved in white blood cells. So here you see the first question. Which of the following is the largest type of WBC? In given options, which of the following is the largest type of WBC? Option A neutrophil, B eosinophil, C monocyte, D lymphocyte. Which of the following is the largest type of WBC? A neutrophil, B eosinophil, and C monocyte, D lymphocyte. The answer is C monocyte. Option C, the monocyte is the largest type of WBC. The next question. Next question, which WBC mainly responsible for antibody production? Which type of WBC mainly responsible for antibody production? Option A neutrophils, B lymphocytes, C T lymphocytes, D monocytes. Which WBC or which type of white blood cells responsible for antibody production? The answer is B. Option B is responsible for antibody production. The next question, normal WBC count in adult. Normal WBC count in adult. Option A 1000 to 2000 cubic per millimeter. 4000 to 11,000 cubic per millimeter, and option C 15,000 to 20,000 cubic per millimeter, 25,000 to 30,000 cubic per millimeter. And the answer is B. The normal WBC count in adult is 4,000 to 11,000 cubic per millimeter. Option C is the right answer. The next question, which WBC are first to respond to bacterial infection? Which type of WBC are first to respond to bacterial infection? A lymphocytes, B monocytes, option C neutrophils, option D eosinophils. And the answer is C neutrophils. Neutrophils are the cells or type of WBC that first respond to bacterial infection. The next question, eosinophils are increased in which condition? Eosinophils are increased in which conditions? Option A bacterial infection, B allergic reaction and parasitic infection, option C viral infection, and option D fungal infection. And the answer is eosinophils are increased in condition B allergic and parasitic infections. Option B is the right answer. Then next question, basophils release which important substance during allergic reaction? Basophils increase which important substance during allergic reactions? Histamine, B. Insulin, C. Antibodies, and D. Pepsin. Option A. Histamine, B. Insulin, antibodies, D. Pepsin. And answer is A. Option A is the correct answer. Basophils release histamine during allergic reactions. The next question, which WBC transforms into macrophages into tissues? Which type of WBC transforms into macrophages in the tissues? In the tissues. Which type of WBC transforms into macrophages in the tissue? Option A. Option A, neutrophils. Option B, monocyte. Option C, lymphocytes. Option D, basophils. Option A, neutrophils. Option B, monocytes. Option C, lymphocytes. Option D, basophils. And the answer is B, monocytes. Monocytes is a type of WBC transforms into macrophages in the tissues. The next question, which type of lymphocyte responsible for cell-mediated immunity? Which type of lymphocyte responsible for cell-mediated immunity? B cells, T cells, plasma cells, natural kill cells. Okay, the answer is B, T cells. The next question, leukopenia. Leukopenia refers to. What is meant by leukopenia? Increase in WBC count, decrease in WBC count, or increase in RBC count, or decrease in platelet count? What is meant by leukopenia? And the answer is B, decrease in WBC count called leukopenia. Then next question, which WBC plays a key role in defense against viral infection? Which WBC plays a key role in defense against viral infections? Option A, eosinophils, neutrophils. Option C, lymphocytes. Option D, basophils. And the answer is option C, lymphocytes plays a key role in defense against viral infection. The next one, most abundant WBC in human blood. Most abundant WBC in human blood. Option A, lymphocyte. Option B, neutrophils. Option C, eosinophil. Option D, monocyte. And the answer is B, neutrophil is abundant WBC in human blood. The next question, lifespan of neutrophil is about. Option A, few hours to 3 days. Option B, 1 to 2 weeks. Option C, several months. Option D, several years. Lifespan of neutrophils is about. Option A, few hours to 3 days, 1 to 2 weeks, several months, several years. And the answer is A, few hours to 3 days. The next question, which WBC called polymorphonuclear cell? Which WBC called polymorphonuclear cell? Which WBC called a polymorphonuclear cell? Option A, neutrophil. Option B, monocyte. Option C, lymphocyte. Option D, basophil. And the answer is A. Option A, neutrophil called as polymorphonuclear cell. The next one, agranulocytes includes. Agranulocytes includes neutrophils, eosinophils and neutrophils, monocytes and lymphocytes, basophils and eosinophils. And the correct answer is C. Monocytes and lymphocytes called as agranulocytes. Granulocytes WBC are basophils, eosinophils, and neutrophils. All we know, WBCs are divided into granulocytes and granulocytes. Basophils, eosinophils, neutrophils comes under granulocyte, and a granulocyte cells are lymphocytes and monocytes. Then, next question. The least abundant WBC is? The least abundant WBC is, and the answer is A, basophil. The next one, phagocytosis first discovered by the scientist. Phagocytosis first discovered by the scientist. Louis Pasteur, Metchnikoff, Robert Koch, Jenner. And the answer is option D. The next question, which WBC produce interferons? Which type of WBC produce interferons? NK cells, neutrophils, eosinophils, and basophils. And the answer is A. Natural kill cells produce WBC NK cells. NK cells produce interferons. The next question, the memory cells of immunity are? The memory cells of immunity are neutrophils, monocytes, lymphocytes, basophils. And the answer is C. Lymphocytes are memory cells of immunity. The next one, which interleukin stimulate T cell proliferation? Which interleukin stimulate T cell proliferation? Interleukin 1, interleukin 2, interleukin 3, interleukin 4. And the answer is B. Then, which WBC fight against helminthiasis worm infestation? It is a parasitic infection, and the option is eosinophil. Eosinophil is a type of WBC fight against helminthic worm infestation. So this is about MCQ on WBC. Thank you all.